Okay, so let's focus on Medicare here. There's some really good things that came out of the Affordable Care Act in regards to Medicare. For any of you out there that is not familiar with Medicare Part D, commonly referred to as the donut hole. The donut hole just refers to the prescription drug benefits for Medicare beneficiaries. So there's minimal amount of money, out-of-pocket expenses on the first $2,800 for prescription drugs. Then you hit the donut hole. Individuals are on their own for the next $3,600 for drugs, and then relief kicks back in for all medications going forward. Again, the donut hole is just that middle part where people are paying out of pocket for their prescriptions. Now, starting this year, the Affordable Care Act actually begins to close that donut hole. Okay, and for anybody that hit the donut hole last year in 2010, they're going to receive a $250 rebate from the government. It's a good thing. Also, this year, Medicare recipients are going to receive a 50% discount on brand name drugs for anyone that hits the donut hole. Again, a great thing. By 2020, the hole will be completely closed, and that's again, another good thing. Also, the health reform bill is going to provide free preventative care. That starts this year in 2011. It's going to eliminate all copays for preventative services and exempt those services from hitting deductibles as well. Great thing for seniors. Much needed. Now, how's this going to affect doctors? If you look at the arrows, they represent two different things. The arrow that's going up, the green arrow, actually corresponds to doctors' overhead, which is the overhead for doctors' practices has been increasing significantly. And the problem is the payments they receive from Medicare, the reimbursements have been decreasing rapidly. It's not sustainable for these docs to remain in practice accepting Medicare patients, unfortunately. In fact, if you look into it, 1 out of 5 doctors and 1/3 of all primary care docs are limiting the number of Medicare patients they see. If you dig down a little further into the details, what's really scary is that 1 out of 4 seniors, or 25% of seniors looking for a primary care doc, are having trouble finding one that'll see them. That's scary. It gets really scary because this year, 2011, marks the year the first of the 75 million baby boomers will turn 65 and can start applying for Medicare. This is going to turn into a huge drain on the system. The boomer generation has more health problems than any other generations in the past. So much that come 2030, if left unchanged, Medicare will become insolvent. Now, another problem here is that we're having less and less qualified geriatricians, folks that specialize in senior citizens, and primary care physicians. Down the road, there's just not going to be enough people properly trained to take care of an entire aging population. Again, 75 million baby boomers. This is huge. The reason is that these primary care and geriatric docs, they just don't make as much money as other specialties. And, when these kids are in medical school, graduating from medical school, coming out with a few $100,000 in debt as a result of going to medical school, and they see their friends going into other specialties where they're going to make, a decent or a lot of money, the attraction from a lot of them, it just isn't there to go into primary care or even geriatric care. And, unfortunately, the principles of economics, we keep going back to economics, but it remains true in every industry. To treat a senior citizen for a variety of reasons, it just takes a lot longer than it does to treat children or middle-aged adults. Senior citizens require extra care. They require more time spent with them. There's a lot more of a medical history. They have more problems. I mean, the folks that treat them should be getting paid a lot more money. I mean, there's a lot more intensive care that needs to go into them. But they're not able to see as many patients. Their volume's lower because the time constraints forced on them. They're just not making the money as if they're in a different field. This is serious. The American Geriatric Society actually came out and said there are 7,000 board-certified geriatricians in the United States. That's one doc for every 2,700 Americans aged 75 and older. They forecasted, again, American Geriatric Society, they forecasted that by the year 2030, this ratio is going to drop in half. It's going to be one geriatrician for every 5,500 seniors. Very, very, very scary. Something needs to be done, and something needs to be done fast. All right, let's switch gears here. We're going to, I think we're running out of time, but just wanted to highlight a couple things about wellness programs. Wellness programs are great and becoming ever more popular, and there's a lot of good reasons for that. In the Affordable Care Act, good thing, to encourage more companies to offer wellness, preventative care programs. All that in 2014, the government's actually going to increase the amount that employers can deduct for wellness programs from 20% to 30%. That's big. 10% increase might not sound like a lot, but if you look at, if you go back to 2009 and you look at the average family coverage plan, the average premium, it's about $13,000. So a 10% increase provides an extra $1,300 as a credit. That's huge. That's great. The goal is let's get millions and millions of more people access to programs that are going to help them in various ways: losing weight, quitting smoking, managing their stress, making healthy decisions, and that's really good. Also, for small, mid-sized companies, they can apply for 5-year grants, and there's some criteria they need to meet to qualify, such as they offer screenings and assessments, mechanisms to encourage employee participation, initiatives to change unhealthy behaviors, and so on and so on. Point being is this is the kind of change that's great, giving people the power, the wherewithal to make healthy, proactive decisions, getting employees to make value-based decisions about their health. This is one of the areas that will reduce healthcare costs, decrease absenteeism among the workforce, and really create a more productive workforce as well. We'll get into more wellness next month, but I just wanted to highlight some of that here. With that, we're gonna open it up real quick to maybe a question or two. If you have any, go ahead. I know I see a couple in here. Go ahead and feel free to type in a message while you're doing so. As you can see on the screens, our number's there, our email. Feel free to visit us online. We'd love to hear from you. If you'd like answers to any of your other questions, feel free. We'd love to hear from you. And with that, I'm just looking at some of the messages that rolled in. Okay. There's still some confusion on the court cases and what's going to happen. So there's some back and forth going on. Again, federal judge. I think I'll try to answer everyone's questions on this answer here. There's just a few. Judge Vinson down in Florida said the individual mandate is unconstitutional. Again, because you can't separate it out, the whole bill is unconstitutional. Same thing with Judge Hudson down in Virginia, although he just left it at the individual mandate. The Obama administration, they appealed yesterday to the court saying, can you overrule his decision? You're going to see a lot of back and forth. Virginia actually said, hey, let's forget that. Let's just go straight to the Supreme Court. That's not going to happen. It's got to go through the system, and it will. But eventually, the Supreme Court's going to have to rule on it. And I think they're going to try their best to not rule politically. I think they're really going to look long and hard at the Constitution. And if you look at the justices, if you hear a lot of commentary out there, they're probably going to rule. And this is just speculation. I'm by no means a legal expert, but they're probably going to rule the individual mandate to be unconstitutional. It's going to be probably a very close, 5-4 type decision coming down. What that will mean is that regardless of what happens next November, there's going to be some changes into healthcare. If President Obama gets reelected, you're going to see probably this individual mandate. If the Supreme Court rules it unconstitutional, that coming out of it, you'll see a lot of the other things in there remain, and the pre-existing conditions, and the annual and lifetime limits, allowing kids up to 26 years of age to be on their parents' insurance. Things like that are going to remain in there. Clogging the donut hole in Medicare, that's going to remain. If he's not elected, somebody else comes in as president, then then most likely, again, I'm not a legal or political expert, but you're probably going to see a whole revamping of the entire health bill. You're probably going to see, some stuff will stay, some of the good ones, but it's going to be more on a value-based position, more market-driven, more geared towards getting people more access to care in a good amount of time than anything else. We have to leave it from there, but I appreciate everyone on here. Appreciate your questions, and again, feel free to reach out to us. Have a great day. Bye.